be a threat to the progress that we've made as a nation. We're entering the winter in a strong position, thanks to the decisions we made in the summer and the defences that we have built. Our vaccination programme has been moving at a blistering pace, and this weekend we reached the milestone of 17 million boosters across the UK. This means that even though cases have been rising, hospital admissions have fallen a further 11% in the past week, and deaths have fallen by 17%. But just as the vaccination programme has shifted the odds in our favour, a worrying new variant has always had the opportunity to shift them back. Last week, I was alerted to what is now known as the Omicron variant, now designated a variant of concern by the World Health Organization. We're learning more about this new variant all the time, but the latest indication is that it spreads very rapidly. It may impact the effectiveness of one of our major treatments for COVID-19, Ronapreve. And, as the Chief Medical Officer said this weekend, there's a reasonable chance that our current vaccines may be impacted. I can update the House that there have now been 5 confirmed cases in England and also 6 confirmed cases in Scotland, and we expect cases to rise over the coming days. The new variant has also been spreading across the world. Confirmed cases have been reported in many countries, including Austria, Belgium, the Czech Republic, Denmark, Germany, Italy, the Netherlands, and Portugal. In this race between the vaccines and the virus, the new variant may have given the virus extra legs. So our strategy is to buy ourselves time and to strengthen our defences while our world-leading scientists learn more about this potential threat. On Friday, I updated the House about the measures we've put in place, including how, within hours, we'd placed 6 countries in southern Africa on the travel red list. Today, Mr. Speaker, I'd like to update the House on more balanced and proportionate steps that we are taking. First, measures at the border to slow the incursion of the variant from abroad. On Saturday, in line with the updated advice from the UK Health Security Agency, we acted quickly to add 4 other countries to the travel red list: Angola, Mozambique, Malawi, and Zambia. This means that anyone who's not a UK or Irish national or resident who's been in any of these countries over the previous 10 days will be refused entry. And those who are allowed entry must isolate in a government-approved facility for 10 days. Beyond this red list, we're also going further to put in place a proportionate testing regime for arrivals from across the world. So we'll require anyone who enters the UK to take a PCR test by the end of their 2nd day after they arrive, and to self-isolate until they receive a negative result. The regulations for this have been laid before the House today and will come into effect at 4 a.m. tomorrow. Second, we've announced measures to slow the spread of the virus here in the UK. We're making changes to our rules on self-isolation for close contacts in England to reflect the greater threat that may be posed by this new variant. So close contacts of anyone who tests positive with a suspected case of Omicron must self-isolate for 10 days, regardless of whether they have been vaccinated or not. Face coverings will also be made compulsory in shops and on public transport in England unless an individual has a medical exemption. The regulations for self-isolation and face coverings have been laid before the House today and will come into force at 4 a.m. tomorrow. But I can confirm to the House that there will be a debate and votes on these 2 measures to give the House the opportunity to have its say and to perform valuable scrutiny. My right honourable friend, the Leader of the House, will be setting out more details shortly and will be reviewing all of these measures that I've set out today after 3 weeks to see whether they are still necessary. Third, Mr. Speaker, we're strengthening the defences we've built against the virus. We're already in a stronger position than we were when we faced the Delta variant. We have a much greater capacity for testing, an enhanced ability for sequencing, and the collective protection that's offered by 114 million jabs in arms. And so I would like to update the House on our vaccination programme as well. Our COVID-19 vaccination programme has been a national success story. We've delivered more booster doses than anywhere else in Europe, and we've given top-up jabs to over 1 in 3 people over the age of 18 across the United Kingdom. I'd like to take this opportunity to pay tribute to the NHS, the volunteers, the armed forces, and everyone else that has been involved in this life-saving work. Our vaccines remain our best line of defence against this virus, in whatever form it attacks us. There's a lot we don't know about how our vaccine responds to this new variant. But although it's possible that they may be less effective, it's highly unlikely they will have no effectiveness at all against serious disease. So it's really important that we get as many jabs in arms as possible. Over the next few weeks, we were already planning to do 6 million booster jabs in England alone. But against this backdrop of this new variant, we want to go further and faster. So I asked the JCVI, the government's independent expert advisors on vaccinations, to urgently review how we could expand the programme and whether we should reduce the gap between second doses and boosters. The JCVI published its advice in the last hour. First, it advised that the minimum dose interval for booster jabs should be halved from 6 months to 3 months. Second, that the booster programme should be expanded to include all remaining adults aged 18 and above. Third, that these boosters should be offered by age group in a descending order to protect those who are most vulnerable to the virus. So priority will be given to older adults and people over 16 who are at risk. Fourth, that severely immunosuppressed people aged 16 or above who've received 3 primary doses should now also be offered a booster dose. Finally, that children aged between 12 and 15 should be given a second dose 12 weeks from the first dose. I have accepted this advice in full. With this new variant on the offensive, these measures will protect more people more quickly and make us better protected as a nation. It represents a huge step up for our vaccination programme, almost doubling the number of people who will be able to get a booster dose to protect themselves and their loved ones. And I know that we are asking more from NHS colleagues who've already given us so much throughout this crisis, but I know that they will be up to the task. The NHS will be calling people forward at the appropriate time so that those who are most vulnerable will be prioritised. And I'll be setting out more details of how we are putting this advice into action in the coming days. Mr. Speaker, our fight against this virus is a global effort, and so I'd like to update the House on the part that the UK is playing. We currently hold the presidency of the G7. And earlier today, I convened an urgent meeting of G7 health ministers to coordinate the international response. We were unanimous in our praise for the leadership shown by South Africa, who were so open and transparent about this new variant. And we were resolute in our commitment to working closely with each other, the World Health Organization, and, of course, the wider international community to tackle this common threat. Mr. Speaker, our experience of fighting this virus has shown us that it's best to act decisively and swiftly when we see a potential threat, which is why we're building our defences and putting these measures in place without delay. Scientists are working at speed, at home and abroad, to determine whether this variant is more dangerous, and I can assure the House that if it emerges that this variant is no more dangerous than the Delta variant, then we won't keep measures in place for a day longer than necessary. COVID-19 is not going away, and so we'll have to keep seeing new variants emerge. So if we want to live with the virus for the long term, we must follow the evidence and act in a proportionate and responsible way if a variant has the potential to thwart our progress. And as we do this, we are taking a well-rounded view, looking not just at the impact of these measures of the virus, but the impact to the economy, to education, and non-COVID health, such as mental health. And I'm confident that these responses that we set out today are balanced and responsible steps that are proportionate to the threat that we face. Mr. Speaker, this year, our nation has come so far down our road of recovery, but we always knew that there would be bumps in the road. But this is not a time to waver. It's a time to be vigilant and to think about what each and every one of us can do to slow the spread of this new variant. Getting a jab when the time comes, following the rules that we've put in place, and getting rapid, regular tests. If we all come together once again, then we can keep this virus at bay and protect the progress that we have made. I commend this statement to the House.
Shadow Minister Dr. Rosina Hallen-Khan.
Thank you, Mr. Speaker, and I'd like to start by sending my best wishes to the Shadow Secretary of State, who cannot be here as he is currently off with COVID, and we all hope he gets better soon. I'd like to thank the Secretary of State for advance sight of his statement. This variant is a wake-up call. The pandemic is not over. We need to act with speed to bolster our defences to keep the virus at bay. And it is also an important reminder that no one is safe until all of us are safe. Ministers have not met the commitments that were made this summer at the G7 to get the vaccine rolled out to other parts of the globe. What update can the Secretary of State give on the government's global commitments? And given that Omicron is already here, what we do at home truly matters. There are measures that we can put in place right now to keep infections down and ensure the country has the best possible protection. Can he set out the rationale for not introducing pre-departure testing? Surely this would be an effective way of preventing people travelling with COVID into our country. We support the decision to introduce masks on public transport and in shops, but we believe this should never have been abandoned in the first place. Keeping masks in place would always have been our plan A. Will the Secretary of State extend the use of masks to hospitality and other settings? Or does COVID not spread in pubs? Most importantly, what is the plan to enforce mask wearing? Shop workers have given so much during the last 20 months alongside our emergency services. Asking shop workers to enforce mask wearing is yet another pressure that they do not need and do not deserve. If masks had been mandatory, it would have been harder for this new variant to spread. A global study published in the British Medical Journal argued that face mask wearing can bring transmission down as much as 53%. And this government's flip-flopping on masks has created confusion across schools, colleges and universities. So can the Secretary of State today confirm the new requirements across all education settings? And the Prime Minister is not the best person to tell people to wear masks when he can't even be bothered to wear one himself when he goes into a hospital full of vulnerable patients. And can I ask the Secretary of State when Conservative backbenchers will start wearing their masks? Can the Secretary of State update the House on when he expects there to be a decision on vaccinations for younger children? As the government has fallen far short of its own target to offer all 12 to 15-year-olds the vaccine by October half-term, so can he say what action will be taken to speed up vaccine rollout? Our NHS have done us proud and have done a fantastic job to deliver the vaccine, offering first, second, third and booster jabs all at the same time as treating patients suffering from COVID and trying to recover elective procedures. I'd like to take this time to thank everyone who works in our NHS and care sector. And we're putting even more demands on them at the moment. Our NHS has stepped up to the challenge, and it is a shame that this government simply hasn't done that. Vaccine rates among those with mental illnesses are low and mortality rates high. The government needs to stop weaponising mental health and instead must recognise that good, clear, honest communication is so important in a crisis, something that they have failed to do so far. And I know, and I've mentioned time and time again, but the government must acknowledge the trauma for people with severe COVID, long COVID, and NHS staff. So where is their plan? Labour has been clear throughout this pandemic that proper sick pay will help people to isolate. The government has chosen to ignore us time and time again, so I ask again, what support will be available to people who need to self-isolate? And isn't this the time to finally fix sick pay? I would also appreciate it if the Secretary of State could update the House on the new antivirals and how they will be utilised. And why are the government not already giving antibody tests to the immunocompromised? The situation we find ourselves in now was entirely predictable. Yet again, this government have shown they are incapable of protecting our communities, protecting our NHS and saving lives.
So stay.
Thank you, Mr. Speaker. First, can I also extend my best wishes to the Shadow Health Secretary and wish him a speedy recovery. I do have to say, Mr. Speaker, I do think the Honourable Lady has misjudged the tone of the House. This is a very serious matter. And I think the whole country would be looking for all members of this House to work together and to support the nation. And surely she isn't blaming the UK government for the emergence of this new variant. I feel, Mr. Speaker, perhaps she was just auditioning for the reshuffle that's going on in her party right now. But let me, Mr. Speaker, answer the questions around. She asked about international donations. And the UK is leading the world in international donations, quite rightly so. It is absolutely right that that is treated as a priority. We would like to see other countries step up as well. The Prime Minister made a pledge a few months back of 100 million donations by June 2022, 80% of those through COVAX, of which we are a huge supporter, and 20% bilaterally. And so far we have donated over 20 million, more than many other countries. And COVAX, as I said, an organisation we help found and we support, has donated, I believe, some 537 million doses to 144 different countries. The rules, the Honourable Lady asked about the rules on travel and masks and others that I set out. Well, I will say, Mr. Speaker, I think I've addressed that. I do believe that they are proportionate and it's a balanced response. On the vaccine rollout, we've just set out a huge expansion of the vaccine rollout programme. It's a shame that the Honourable Lady could not find it in herself to welcome that vaccine rollout. And as I said, I will set out more details in coming days on exactly how we intend to meet the requirement to vaccinate more. And then on antivirals, we're one of the few countries in the world that have procured the two leading antivirals. We were our regulator, the MHRA, our independent regulator, was the first in the world to approve one of those antivirals. I'm pleased with the over 700,000 courses that we have for citizens across the United Kingdom, but of course, given the emergence of this new variant, we'll be reviewing that and seeing if more needs to be done.
Chair of the Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. The late Donald Rumsfeld coined the phrase known unknowns, and that is what we face with the new Omicron virus. So the Secretary of State is absolutely right to take sensible and proportionate measures to buy time while we are waiting to understand how dangerous this new variant can be. But does he not agree that the fact that we are facing this danger is also a symptom of the failure of Western countries to make sure that vaccines are distributed adequately around the world? And whilst I recognise the enormous contribution the UK has made through COVAX, through the development of the AstraZeneca vaccine and so on, is it not a moral and practical failure that richer countries have managed to vaccinate 60% of their populations, when for poorer countries it's just 3%?
So stay.
First of all, Mr. Speaker, can I thank my right honourable friend for his support? And I do agree with his words. It is important that all rich countries do everything they can to support vaccines and donations of vaccines to developing countries. I set out earlier what the UK has done, and we can be proud of that, but we do need other countries to set up. In the G7 meeting I chaired earlier today with health ministers, we all agreed of the importance of this and about redoubling efforts to make sure all commitments are met.
SNP spokesperson Richard Thompson.
Thank you, Mr. Speaker, and can I thank the Secretary of State for advance sight of his statement, and also add my own thanks to the work that the NHS does and continues to do in all parts of these islands to keep us all healthy and safe. The emergence of Omicron, including the 6 cases that we've seen in Scotland, along with the evidence of community transmission, shows that this is absolutely no time to be complacent. But for all the measures that are being taken now at the border, day 2 PCR testing, because of the incubation period, risks missing a number of these cases passing through the border. And a more effective approach, surely, would be to introduce day 8 PCR testing along with 8 days of isolation to accompany it. And it would surely be better to do that now than to be bounced into that position by events further down the line. Secondly, Mr. Speaker, the Secretary of State issues a call for us all to work together, which I'm sure we would all wish to be able to do. But I wonder if he shares my disappointment that when the First Ministers of Scotland and Wales today called for a COBRA meeting to be convened, it appeared to be dismissed out of hand already. So I wonder, will the Secretary of State prevail upon the Prime Minister to call, attend and convene an urgent COBRA meeting involving all 4 nations, so that people might be persuaded that he's on top of this development, as we would all expect him to be? And finally, I wonder, would the Secretary of State agree with the opposition front bench and the Chair of the Select Committee and myself that this emergence of this variant shows that none of us are safe until all of us are safe, and that however much is being done and however much the UK has done to date, more still needs to be done in order to achieve as close to 100% global vaccination as is possible. That not only includes the vaccination programmes that we're in, but it involves increasing global vaccine production as well as overcoming the barriers that patent law might place in the way of achieving that.
Thursday.
Mr. Speaker, can I first turn to the honourable gentleman's question around the day 2 testing? We do believe that the day 2 testing requirement is the proportionate response for international travel. He will know that it applies to all incoming arrivals into the UK, and that the individual concerned would have to self-isolate until they get a negative test result. And I think that is the right response. In terms of meetings and UK nations working together, I think that has been one of the successes of the UK response to this pandemic, the way that the nations across the UK have worked together, especially on vaccines, on testing, on surveillance and antivirals, and it shows that we're stronger together.
Greg Clark.
Thank you very much indeed, Mr. Speaker. So Andrew Pollard, who developed the Oxford vaccine, predicted to my Select Committee in June that new variants would escape the vaccines by being more infectious, but the protection against severe illness should continue. Yes. So will my right honourable friend avoid taking any panic measures if we see a rise in infections during the weeks ahead, as seems inevitable, and concentrate instead on the vaccine's effectiveness against severe illness and hospitalisation?
Mr. Speaker, my right honourable friend is absolutely right. We have already, as I referred to in my statement, even with the dominant Delta variant at the moment, we have seen some rises in infections, but we've been seeing falls in hospitalisation, in death rates, thankfully too. And the reason for that is the power of the vaccines, especially our booster program, the largest in Europe. So my right honourable friend is absolutely right that what matters as we look ahead around this new variant is what matters more than anything is hospitalisations.
Fly back.
Thank you, Mr. Speaker. The second line in the Secretary of State's statement says, "We've always known that a worrying new variant could be a threat to the progress we've made as a nation." With that in mind, does he think it was wrong for the government to abandon mask wearing in public places and confined spaces? And will he listen to the recommendations of Doreen Lawrence's report and start to issue full face protection masks to care workers and health workers?
So state.
Mr. Speaker, surely the honourable gentleman isn't suggesting that if we had different rules on masks over the summer, that this new variant would not have emerged?
Andrea Lenson.
Thank you, Mr. Speaker. I'm sure my right honourable friend will want to pay tribute to the South African government for raising the existence of the Omicron variant, and obviously that has resulted in them having a travel ban imposed. I do have constituents and in fact family members stuck in South Africa. So can my right honourable friend tell us how long he expects cancellations and suspensions of flights to occur? Because obviously for anyone stuck overseas it's a very worrying time.
State.
First of all, I join my right honourable friend in again expressing thanks to the South African government about how they have handled this difficult situation. And I also understand what my right honourable friend has said about her constituents. Many of us will have constituents in a similar position. And it is hard to say when direct flights might start. But we have started our hotel booking programme. So that is one part of trying to get our citizens back. But we will do everything we can to support them in that way.
Well, Rivals.
Thank you, Mr. Speaker. Can I ask the Secretary of State, quite rightly, we praised the South African doctor, but she saw her patient face to face. Could I ask the Secretary of State what advice, guidance or instruction he's going to give to the GPs? I know my constituents in Walsall South are keen to see their GPs face to face, but this may be more effective than test and trace.
Tuesday.
Mr. Speaker, the honourable lady is an important question, and one thing we are doing at this point is updating guidance throughout the NHS, including primary care.
Thank
you very much, Mr. Speaker. In his statement, the Secretary of State said that the legislation that he's laid before the House, which incidentally isn't yet available on the legislation.gov website for members to study, he said close contacts of anyone who tests positive with a suspected case of Omicron must self-isolate for 10 days regardless of whether they've been vaccinated. Can I just confirm with him, first of all, that is what is in the regulations, and secondly, for the benefit of the House, could he set out what he set out yesterday in the television studios, the mechanism by which the Omicron variant will be identified and communicated